Here at Dr. Alex. Worked on my my ankle right here. Okay, ligament pain right over here. I still feel it. And now I gotta put it here on my shoulder. GizzyCredit. Hey, here with Dr. Alex again. Help with my shoulder, which I had the
shoulder strain.
Shoulder strain. So every time I go, like if I go triangle like that, oh, you see
the pulling down.
The pulling down. Like if I put like
pressure on
like
it.
Pressure on there.
You feel it right here.
I feel it right there. I feel it like inside there somewhere.
Yeah, it's all the connections.
Okay, so that's why when I do the CrossFit and I put the bar over here, I know it's gonna it lays here.
Yeah.
But it feels much better than last time.
Okay. So we're gonna work at it again. All right. So
okay.
Let's take the shirt off. All right.
I haven't been going to the gym, so excuse the extra stuff. Oh my goodness. Oh, so you have a couple of those.
Yeah.
Okay.
So we got different blades, depending on the muscle that we're gonna work on. So there's different contours, depending on what muscle groups we're gonna work on. We have some here that are specifically designed for the Achilles tendon, also for the hands. So it just depends on what kind of injury you have. We'll use the appropriate tool for it.
And chrono, what's it called? That technique?
This is a stainless steel medical. Yeah, this here.
But the technique is...
This is called the Graston technique.
The Graston.
Graston technique is very commonly, it's basically instrument assisted soft tissue work. So we use the metal because it gets deeper into the muscles and tendons better than we would with our fingers.
Wow. So again, it's right over here. Yep. Oh, yep. You felt that before?
This one here.
Right there.
Okay. So let's see if we can get better angle here.
Okay. You want me to sit down? Or
no, this is okay
up?
like this.
Oh, you're gonna be working standing up today.
We're gonna do standing up. We can do things either standing up. We're actually gonna get to the point where we do them in the position that it's creating pain.
Ooh, okay.
That way we know the muscle and the tendon can go to that range. All right. Right now you're saying this is causing you pain, so we gotta work this area out.
Okay.
In fashion.
Okay. Ooh.
So what you gotta remember is there's a lot of connections. It's rarely that you injure just one little muscle or one little tendon. There's many connections into here. You have the pec, you have the deltoids, you have the middle deltoids, you have the anterior deltoids, you have a lot of muscles in here, pec major crossing in. There's a lot of things that are happening in this area. So you gotta work around the whole joint. So
okay.
And
how about the nerve system in there?
The nerves, they're much deeper in there.
Okay.
So we're not gonna tackle any nerves in this area.
Okay. But I do feel that right there when you do that. I feel it.
So right in here, we're tackling. This is the deltoid muscle.
Oh.
All right. Responsible for any of the overhead lifts that we do.
And it's supposed to hurt.
Yes, it will hurt. And you may or may not see it's starting to get a little bit red in here.
Yes.
Which this means this is where the tissue is injured.
Oh, that's amazing.
And he's having some pain in here.
Oh, yes.
That is the dysfunctional tissue. Now, I could do that in the back of this muscle with the same intensity, and he has zero pain. There's nothing going on in there. There's no red reaction happening, as you see there. Nothing is going on. But here, where it's injured, that's where he's feeling all of the pain.
Yes.
Same intensity. So, last week we worked more on this front part, and this week I'm looking at more at this area here.
Okay.
How are we doing here?
I'm not doing bad at all right there.
No pain, right?
No pain. That's amazing. It was hurting there last time.
It was hurting here last time.
Yeah.
So what that means is this area is cleared out. Again, I see no redness. He's not having any pain reaction. So that means we're in the right direction. That means his tendons are healing.
Okay.
So we're gonna hang out here a little bit more. We're gonna go a little bit more into this area. there is some injury here. Some redness in here, not as bad as this part, but this connection here is the one we need to work on. So what you got to understand about these sport injuries, gym injuries, is it's never really something that's isolated. We don't work with an isolated muscle. We work with muscles in unison. They work in groups. So you tend to have an injury kind of in groups at the same time.
Oh, right there. Oh, it's discomfort right there.
Yep.
Damn it. Oh.
So the best analogy I can give you with this is whenever you have this kind of injury, muscle and tendon, it's like a shirt that's very wrinkled. So the muscles have wrinkled themselves like this, and we're trying to flatten everything out and get it properly aligned. Once you have proper alignment of the fibers in this fashion, then the muscle is going to work the way it's designed to work. But right now, everything is bunched up, and what I'm trying to do here is iron the muscle out, and that's the kind of therapy that we do for sports injury.
Oof.
So we're gonna go just a little bit more. We have enough of a tissue reaction here. Just a little more in this area.
Does it feel that bad right there?
This one's not terrible, right?
No.
No. This is compared to last week. This one's
yes.
doing really well.
Correct.
So right now the focus is going to be, if you just get a little closer to the camera here.
Yeah.
See, we have the deltoid lateral, anterior, and some of the pec. This is all the connection in here. So this is where the healing has to occur. Now, we all, obviously this is going to be sore. Like you felt last time, it's sore.
Yes.
This is advanced work, so he's going to feel sore for about 2 or 3 days.
Correct.
This is going to clear out, and the body's going to start to produce new fibers that are in a better orientation, so he can get back to doing all the lifting, CrossFit, etc.
Yes.
Okay.
That's good?
For the shoulder, yep.
For the shoulder, let's keep it going.
Keep it going?
Yeah.
All right.
Now with the, this is getting better too,
Ankle.
the ankle. So, you want me to stand somewhere?
Let's go here. All right, so basically, for those of you who have been following this injury, we have a ankle sprain to the outside.
Right there.
This ligament, I know from last time, this is the one that we got to continue to work on. All right, this is one of your lateral ligaments. You have 3 main ones in the outside part of the ankle. We have this one here, and one towards the back. And of course, the middle one is usually the one that's mostly injured. So we're gonna work at it. What he has is ligament pain. What most people experience is ligament pain when they twist their ankle.
Yes.
It's not muscle pain, it's ligament pain. This is the one that's holding this bone to that bone. So when it goes like that, it overstretches and it hurts.
Yes. But you know what? It doesn't hurt as bad as it did the first time.
Right. It's gonna feel less. And what you have to understand about ligaments, crowd over there, is ligaments take some time to heal. And my goal here for Guillermo is not to just get rid of his pain. Getting rid of pain is easy. However, restoring the proper function so that he can go do all his crazy races, 200-mile plus races.
Yes.
Do CrossFit. You need to have good performance of your ligaments, good performance of your ankle.
There you go.
So that's what we're attempting to do here. All right.
Oh my God.
Now again, one of the things I want you to see, here's one of the ligaments that's not injured.
Correct.
So I could do this all day long here, and he's not going to experience any pain or any discomfort.
Correct.
Okay? So there's no problem with this ligament. This is fine.
Correct.
When I go here, it's a different ball game. He starts singing some songs, playing music, acting like a hyena. And ladies and gentlemen, this is painful work. This is not easy, but it works fast. So it's better to take the pain, get your ankle back, get your performance back, and just suck up the pain, basically.
Yes. Oh my God.
Now, next week, I will be doing this with him in a standing position, and I'm gonna put his body weight on this ankle, and I'm gonna work the ligament.
Ooh.
That one is gonna be a little bit more challenging, but he's ready for that.
Yes.
So this is progressive. In the beginning, I start this treatment by allowing the treatment to, we do it what we call passive. We do it with you just relaxing, laying down here. Later on, we add weight because you're gonna be weight bearing, you're gonna be running, you're gonna be jogging, you're gonna be jumping boxes, etc.
Correct.
So we need this ligament to respond, sir. And while we're at it here, talking about ankles, this is one of the reasons that people will tend to twist their ankle, the same one. And they say, I twist the same ankle over and over and over. The reason they do that is because they never healed it properly.
Oh,
they just rested it, they did nothing, they waited 2 or 3 weeks, or even 2 or 3 months, and then they got back to playing and they sprained it again.
Yes.
Because they never healed the original injury to begin with.
I think that's what happened to me.
And there he goes singing again.
Oh. Nothing there. Nothing there.
Nothing here. So
nothing there.
For those of you, we have this posterior ligament here, right behind the ankle. No pain. 0. Nothing happening here. He did not injure this area. This is fine. In the beginning, he had injured this area.
Correct.
Now it's healed. No problem. This is our last remaining piece of the ankle injury. So we're going to work this area out. And we're going to do what we call a pressure point that we're going to finish up with. So he's pretty close to coming to an end with this injury.
Yeah.
Now we're going to do the pressure point.
The pressure point.
This one hurts probably the most of all, but necessary.
Yeah. 5 seconds. Oh.
Okay, 5 seconds. Here we go. And 5, 4, 3, 2, 1. Relax. Okay. And basically what I'm doing there is I'm pushing as many of those fibers that got overstretched back into place. And the analogy for this one is if you ever went camping and the stake of your tent came out, it makes the tent loose. So we got to stick the stake back in. That's basically what we're doing here with the pressure point. All right, and 5, 4, 3, 2, 1, 0. And we got the last one. And then we're going to be done for today.
Okay.
And ready? 5, 4,
Not that bad.
3, 2, 1. Oof. So this part of his ankle wasn't so bad today, just this midsection here.
Yes.
So that's what we will tackle next week.
Thank
All
you
right,
so
thank
much.
you for your attention, guys. And Gizzy will get you back in the game.
Thank you so much.
GizzyCredit, getting better. You'll see me soon. Gracias a Dios. Thank you so much, Dr. Alex. Over here, 83rd.
84th and Kennedy Boulevard.
84th and Kennedy Boulevard here in North Bergen, New Jersey. GizzyCredit. See you later. So now it's time to recover with some ice. Put ice for the next 3 days. One time, 15 minutes. And right down there too, ice. So if any of you got some injuries, sports injuries related, definitely hit up Dr. Alex here in North Bergen. Very fast way to get here if you're in Manhattan, especially by George Washington Bridge. If you're in Bergen County, this is Hudson County. You can always come by, friendly. They speak Spanish and English here, so definitely something good. Hashtag GizzyCredit, gonna be posting more me getting better videos as well. See you later.